My name is Keith. I'm a nurse practitioner. I'll be one of the people taking care of you today. How are you doing today?
Great, how are you?
Good. And you are here for what reason?
A checkup.
Checkup? Okay. And what was your name?
Alexa.
Okay. Last name?
Gauntz.
Okay. And do you know what today's date?
November 6th,
Okay.
2013.
Very good. Okay. So the patient is alert. She's oriented. Okay. Patient alert and oriented times 4. Person, place, time, and situation. Okay, so she's letting us know that she's here for a checkup. The first thing I'm going to do is go ahead and start with the scalp and work my way down. If you can go ahead and let your hair down.
Okay.
Oh, have we started time?
It's on the camera.
Perfect. Perfect. Okay. So her hair is blonde. It is fine. It is well groomed. It is clean. Okay, and going through and looking at the scalp. Okay. And I don't note any kind of lesions. Okay, I'm going to palpate this scalp and skull, and I feel no nodules. The scalp is, or skull is normal cephalic, okay, and I'm moving the actual scalp over the skull, and it does move freely over the skull with palpation, okay. Next thing I wanted to go ahead and do is actually look at the skin. Her skin is warm, it's dry, it's intact, it's natural in color, and it's consistent with ethnicities. There is no diaphoresis and no cyanosis to the skin. There's some macules scattered around the face. None of those I would be concerned about as far as possibly being cancer. Okay. Next thing I want to do is go ahead and start looking at the eyes. Her eyes are equal, okay, and symmetrical, bilateral. Use my pen light and go ahead and look at the pupils, and the pupils are about 4 millimeters, and that is bilaterally. Okay, they constrict down with light, and if I can have you look at that curtain back here, and then look at the pen light. Okay. Pupils dilate with distance and constrict and converge with up close. So her pupils are equal, round, reactive to light and accommodation. So cranial nerve 3 is intact. Next thing I want to do is go ahead and have you watch this for me. Back to midline. Good. So extraocular movements are intact. That's cranial nerves 3, 4, and 6, and all of those are intact. Her sclera is white. There is no icterus. Okay. Go ahead and bring the eyelids down. Oh, look up. Okay. The conjunctiva in the inner lower lid is pink. It's moist. The conjunctiva over the sclera is clear. There's no signs of subconjunctival hemorrhage. And once again, like I said, there's no yellowing or icterus to that. Okay. Otherwise, everything else is normal with her eyes. Okay. Next thing I want to do is look at her nose. And does it deviate a little bit this way? No?
Maybe.
A little bit.
Well, sure, I don't know.
Okay. So let's just say it's midline.
Okay.
It has a little deviation to it. But the bridge of the nose, the skin over that is clear, it's natural in color, consistent with ethnicity, it's dry, it's intact. The nose is midline, and then I'm going to look into the inner nose. And the mucosa on the inner nose is pink, it's moist, it's intact. There is no deviation of the septum. The turbinates are normal, they're not enlarged or what we call boggy. Okay, if you can go ahead and occlude one side and blow out. Okay, other side. Okay, both sides are painted equally. Okay, I'm going to next go to the lips. The lips are moist, they're pink. Her mouth is symmetrical. There is no kind of droop to one side. There are no lesions, no ulcerations, or no vesicles to the lips. If you can pull your lower lip down for me. The inner mucosa is pink and moist, and bring your upper lip. You know what you're signing up for, did you? Okay, and then if you can open your mouth for me. Buccal mucosa is pink and moist. There are no lesions, there are no ulcerations, there are no vesicles to any of those areas inside the mouth. And open up for me once again. Stick your tongue out. Say ah. Ah. Look up for me. Say ah. There we go. And tonsils look to be about 1 plus. The uvula is midline and it rises with phonation. Okay, if you can turn your tongue up for me. A little bit less turning. There we go. Okay, and the floor of the mouth also is pink and it's moist. So let's talk about the mouth. The lips are pink, they're moist. The mouth is symmetrical. The inner mucosa is pink and moist as well. The buccal mucosa is pink and moist. The uvula is midline. It rises with phonation. The tonsils are 1 plus bilaterally. Okay, and just act like you're going to gag. Okay, her gag reflex is intact. So cranial nerves 9 and 10 are intact. That's the uvula rising and the gag reflex. Okay, and the posterior pharynx is also pink and moist without ulcerations or vesicles. Okay. Next thing I'm going to do is go ahead and have you open your mouth for me. Close. Open. Okay, so, does that hurt? Okay, so the patient has free range of motion to her TM joint. She does have clicks bilaterally. They are non-tender, and there is no heat or erythema to the joint. The ears have 1 earring in each earlobe. Any pain when I do this? Pain when I do this? No. So the ears are non-tender. There's no erythema. Okay, the skin is natural in color. The lateral canthus of her eye measures to the top third of the ear bilaterally. And let me turn this way for me. Any pain here? No pain, tenderness, or erythema to the mastoid process bilaterally. No pain there. Good. Next thing I want to do is do preauricular lymph nodes, postauricular lymph nodes, occipital lymph nodes, posterior cervical lymph nodes, submandibular lymph nodes, submental. A little bit of enlargement to the anterior cervical. Any sore throats or anything like that? Drainage? Upper respiratory stuff? Nope. Okay. So no pain though, right? Okay. And if you can shrug your shoulders. And supraclavicular lymph nodes. So all of the lymph nodes are non-tender, non-palpable. Other than the anterior cervical, she has a little bit of prominence to those lymph nodes, but otherwise they're non-palpable. I mean non-tender. Okay. Next thing I want to do is go ahead and have you shrug your shoulders for me. Okay. And then turn your head towards my hand again. Okay. Her strength is 5/5 bilaterally. Cranial nerve 12 is intact. The spinal accessory nerve. Okay. Next thing I want to do is actually palpate the midline. Any pain when I palpate these bones? The cervical vertebra? Nope. Okay. So I'm going to also palpate as I turn her neck. So rotate, flexion, extension, hyperextension, lateral bending. Any pain when I do that? She has full range of motion to her cervical neck, cervical spine. There's no tenderness, crepitus, or clicks to that area. Okay, there's no heat or erythema to her neck. Okay, I'm gonna have you turn that way for me.
Outstanding.
No, just turn to the side. I like to check for her shoulders in this manner so that she's actually able to do the complete circumduction. Okay. The first thing we would want to do is actually look and visualize the joint. There's no erythema to the joint. Also palpate the joint bilaterally. There's no heat to the joint bilaterally. Now I'm going to go ahead and have you, with this arm, completely do a circle. Around. Any pain when you do that? Okay. And then also with that same arm, bring it up, straight up. Abduction, down. Adduction. And then put your hand behind your head. External rotation and behind your back. Internal rotation. Any pain or tenderness when you do that?
No.
No clicks or crepitus as well. There's no erythema to the joint. And go around to the other side. As we always compare, do the same thing. Circumduction, abduction. Go ahead and lift your shoulder up, all the way to the top, down, and behind your head, and behind your back. Okay, and no pain when I do that as well, right? Okay. So by standing on the other side, you're able to palpate the whole joint as it's going through this circumduction. Otherwise, you'll have to release it. Next thing I want to do is look at her arms. Her arms are dry. The skin is intact. She has some macules scattered over both of the arms, but nothing that I would be concerned with. The skin is a natural color, and it is consistent with ethnicity. There's no cyanosis and no erythema to the skin. And once again, it's warm, dry, and intact. The next thing I want to do is actually look at the elbows. Okay, there's no erythema. Good. No erythema. No heat. No heat. I'm going to actually palpate the joint. Extension, flexion. Extension, flexion. Again. Any pain when I do this? So the joint is non-tender. There's no clicks. There's no crepitus, and it is non-tender through range of motion exercise. Okay. I'm going to palpate the wrist. Look at it. No erythema. Bilaterally, okay, and no heat, and then I'm going to go ahead and flexion, extension, hyperextension, radial deviation, ulnar deviation. Any pain?
No.
Flexion, extension, hyperextension. No pain when I do this. There's no pain. They're non-tender. There's no click. She has free range of motion. There's no crepitus to her bilateral wrist joints. Next thing I want to do is go ahead and palpate the wrists of the radial pulse. And those are 2+ and equal. So, actually that was 2+, but 2+ radial pulses bilaterally, 2+ brachial pulses bilaterally, and if I can see your hands for me. Cap refill is brisk and less than 3 seconds to all 10 digits. Okay. While I'm here, I'm going to go ahead and do this. Can you feel that? Does it feel the same?
Mm-hmm.
Does this feel the same?
Mm-hmm.
And does this feel the same?
Mm-hmm.
Good. So cranial nerve 5 is intact. Facial sensation. If you can go ahead and smile at me. Show me your teeth. Stick out your tongue. Puff out your cheeks. Close your eyes real tight. Open them up real wide. Okay? So cranial nerve 7 is intact, the facial muscles. Okay. Next thing I'm going to do is go ahead and did you notice by looking over here, I was like, ah. So that's the reason you want to lay this stuff out in a systematic order, because you may have forgotten that, and you can always go back and do that. Okay, so I'm going to start with the heart. The landmark is the clavicle. We're going to go 1 space, 2 spaces on the sternal border. This is the aorta. Go straight across to the left, second intercostal space, sternal border, pulmonic. Go down 1 intercostal space, third intercostal space is herbs. Fourth intercostal space is tricuspid. And fifth intercostal space, midclavicular line, is mitral valve. Flip to the bell. Okay, so the heart sounds, the aortic and pulmonic valve, S2 is heard louder at the base of the heart, which is the top of the heart. S1 is heard louder at the apex of the heart. S2 is the closure of the aortic and pulmonic valves. S1 is the closure of the tricuspid and mitral valves. Okay, Erb's point, S1 and S2 are heard equally, and that's probably going to be the best location to hear murmurs. The heart is a regular rate and rhythm. There's no ectopy. There are no S3, S4 sounds or murmurs auscultated with the bell when I was auscultating with the bell. Okay. Next thing I want to do is go ahead and listen to the lungs. The landmark, once again, is the clavicle. And this time we're going to be above the clavicle and start with the apice of the lungs and work our way down. We want to auscultate at the apice and not go lower than the 6th rib on the front and the 11th rib on the back. Okay. She has two lobes. We all have 2 lobes on the left, or most of us, unless we've had one removed, but 2 lobes on the left, 3 lobes on the right. Okay? Okay, go ahead and deep breath. Okay. Lungs are clear to auscultation bilaterally. No adventitious sounds, rales, rhonchi, or wheezing auscultated. Vesicular sounds are heard up here. Bronchovesicular, bronchovesicular, vesicular, and vesicular sounds are heard there. While I'm here, I'm going to go ahead and do the carotid pulse. I'll say that's about a 2 plus. And then I'm going to also make sure the trachea is midline, and it is. Okay. Next thing I'm going to do is have you kind of turn that way for me. And if you can bring your hair up for me, and then bring your head forward. Flex it a little bit. There you go. I'm going to go ahead and find C7, move straight across over here, and once again we'll start with the apice of the lungs. Deep breath. Again. And then I'm going to listen between the scapula and the spine. Vesicular sounds are up here. Bronchovesicular, bronchovesicular, vesicular, and vesicular sounds. The lung sounds are cleared auscultation bilaterally into all lung fields. There's no adventitious sounds or wheezing, rhonchi, or rales. Next, I'm going to go ahead and listen to the right lung. Start in the axilla. Deep breath. upper lobe, lower lobe, middle lobe, lower lobe. These are vesicular sounds. Once again, they're cleared auscultation bilaterally, no adventitious sounds. And this side over here, starting the axilla, upper lobe, lower lobe, lower lobe, and lower lobe. So the lung kind of is at an oblique angle, the upper and lower lobe, so you may be hearing a little bit of the upper and lower lobe at that last sound. But once again, those are all cleared auscultation bilaterally, no adventitious sounds, no rhonchi, wheezing, or rattles. Okay, next thing I want to do is go ahead and do the lower extremities. All of the skin is even toned. There is no cyanosis. There's no erythema, and obviously we would be doing this in shorts, but no lesions that I would be concerned with, no cyanosis. The skin is even toned, and the color is natural and consistent with ethnicity. Go ahead and palpate. And cross your legs for me. Palpate for edema. There is no edema here, and there's no edema in the upper extremities. Once again, we're going to visualize the knee joints. They are non-erythemic. There is no heat to either joint. Okay, and she has good range of motion to both of the bilateral knee joints without erythema or heat, and there are no clicks crepitus to either joint with range of motion. Okay, and I'm going to have you go ahead and lay back for me. Go ahead and look at the abdomen, if you can move your hands for me. And so the abdomen is normal contour. There's no distension. The skin is going to be a natural color. There is no lesions, any surgeries. So no surgical scars. If the patient did have surgical scars, you would definitely want to note what the scar was and what kind of surgery she had with that, okay? The next thing we want to do after actually visualizing the abdomen, inspecting the abdomen, start in the right lower quadrant. We're going to auscultate. Obviously, we would not do this over clothes. Right lower, right upper, and left lower. Okay. She has vowel sounds present in all four quadrants. Okay. If there was an absence of vowel sounds, I would listen for a full 5 minutes before I could say that there were no vowel sounds. Next thing I want to do is actually palpate. Any pain when I actually palpate? Here, here, and here. Okay, so she has no tenderness to light palpation in all four quadrants. Go ahead and take a deep breath for me, and breathe out, and I'm going to go ahead and palpate deep again. Again. And again. No pain? Okay, so no pain to light or deep palpation. There are no masses or enlarged organs palpated with the deep palpation. So her abdominal assessment is good. Okay. Next thing we want to do is palpate the actual hip joint. We would want to visualize it, palpate it for heat, and then flex, external rotation, internal rotation, and extension. Same here. Flexion, external, internal, extension. Any pain or tenderness? Okay, so no pain or tenderness to the hips bilaterally without clicks or crepitus. Go ahead and palpate the pulses. The first toe and second toe, make sure that you're right between those two toes. Go up to the mid-foot.
5 minutes.
Okay, start rocking. Radial pulses are 2 plus bilaterally. Versalis pedis pulses 2 plus bilaterally. One plus bilaterally on the post-tibial pulses. Cap refill is brisk and less than 2 seconds bilaterally. There we go. Patellar tendon is intact and 2 plus bilaterally. Just hold here, just relax. There we go. Relax. There we go. There we go. Just hold here, relax. There we go. Relax. There we go. So triceps tendons, biceps tendons, radial deep tendon reflexes, and patellar deep tendon reflexes are all 2 plus bilaterally. I'm going to have you stand up for me. And turn this way. Thoracic spine, any pain or tenderness? Lumbar spine, any pain or tenderness? Concave, convex, and concave. The spine has no vertebral tenderness to the thoracic or lumbar spine. If you can turn this way for me. Oh, just at the waist. Turn that way. And this way. Good. And flexion. Flex. Move forward. There you go. Extension. Hyperextension. Good. Any pain or tenderness? Okay, so she has full range of motion to her lumbar spine without clicks, crepitus, or pain. Okay. I'm going to go ahead and do shoulders, the bottom of the scapula, and the top of the iliac crest are all even. You can go ahead and bend all the way forward for me. And drawing a line down her spine. It's midline, so she has no signs of scoliosis. Go ahead and take a deep breath. Okay. My hands rise evenly with inspiration, so her thoracic expansion is even. And then I'm going to have you turn to the side for me. Bring your arm up. Start with, okay, and back, and then 1 to 2 AP to lateral diameter. Have you turn this way for me. Feet together. Hands to your side. Close your eyes. Romberg test is negative. That's testing cerebellar function. You can walk straight over there for me. And then turn around. Put one heel in front of your toe and walk this way for me. Okay, so tandem walking or heel to toe walking is good and it's normal. Okay, have a seat. Okay, so this completes your head to toe exam. Everything looks normal. I don't see any findings that I would be concerned with. So we'll see you back in a year.
Thanks.
Have a great day.
29 minutes and 20 seconds. You didn't do the
Okay, so what did I miss?
Achilles. Achilles.
Achilles,
What else?
optic nerve.
Oh,
Perfect.
smelling.
She did. He did.
Oh, I
Do
didn't
you
do.
have to actually smell something? If, well, I guess we draw that.
Yes, if
one.
you draw that nerve, you'll have to smell it.
The whisper test.
And the whisper test. Apical pulse. Ooh, I got some work to do. I got some work to do. So how many points is that?
You may be passed.
Barely.
We'll pass you if you pass us.
Can't do it. Did I pass or do I have to do a redo at 11?
Yeah, you got to do
You're
it.
at 11.
Does that help you?
Yeah.
Yeah.
Okay. So hopefully I'll do better at 11.